Good afternoon. I'm Nicole Truag, Associate Director of the UW-Madison Center for Financial Security. Welcome to today's webinar on Financial and Future Planning for Siblings with Special Needs and Disabilities. Our presenter today is Catherine Dahlem with Apt Associates, and our discussants are Karen Harris with the Sargent Shriver National Center on Poverty and Johnette Hartnett, with the National Disability Initiative. If you have any technical difficulties, please call 1-800-442-4614. And to submit questions for the Q&A portion of the webinar, locate the dark gray bar near the top of Media Site, click on the Ask a Question icon, and a window will open. Please type your name, email address, and your question, and hit send. With that, I'll turn things over to Kathy.
Good day. I want to welcome everybody for joining us, and this is a very interesting topic, and I hope everybody has a good opportunity to participate. The research that I'm going to be reporting on today was performed pursuant to a grant from the U.S. Social Security Administration, funded as part of the Financial Literacy Research Consortium. I want to point out that the opinions and conclusions expressed are solely those of the author, me, and do not represent any opinions or policies of SSA or any agency of the federal government or of the University of Wisconsin system, including the Center for Financial Security. Next slide. As Nicole mentioned, I'm with Apt Associates, and we're a mission-driven global leader in research and program implementation in the fields of health, social, and environmental policy and international development. We're known for our rigorous approach to solving complex challenges, and we were ranked as one of the top 20 global research firms in 2011. And we're also named one of the top 40 international development innovators. Our company has multiple offices in the U.S. and program offices in nearly 40 countries. The work that I'm going to be talking about today is a continuation of work that Apt Associates has been very proud to do with the University of Wisconsin and the Center for Financial Security. Next slide. The work that I'm talking about today followed up on focus groups that we held in 2010 with parents of children 16 to 21 years old who were receiving child SSI and or Medicaid, and we did the focus groups in Wisconsin and Iowa. Following up on that, there were a lot of issues that came up about family, financial planning, estate planning, future planning, and we were interested in talking to siblings to learn more about their role in their family's planning efforts. So we conducted focus groups in 2012 about financial and future planning for siblings with special needs and disabilities, and these were held in Seattle, Washington. Yes. The 2010 focus group findings, again, that were done with parents of children, young adults, were in 4 primary areas. The parents were frequently unaware of what their long-term financial or legal options were. The parents did not know how or where to access financial planning or legal services in their community. This was particularly an issue in small rural communities. Parents were concerned about the cost of financial planning and legal services, particularly parents who had no access to legal aid or who had never worked with a financial planner, or in many cases had never even consulted an attorney. Parents were very concerned about the impact on other children in the family and what their role would be for caring for their siblings when the parents were no longer able to do so. This focused both on guardianship and the impact that parents felt that they had when they were not able to, help their other children along financially. But there was a lot of concern and fear about what was happening. Next slide. The sibling-related research that we've done in 2012 focused on 3 primary areas. We conducted interviews with nonprofit organizations, advocacy groups, sibling support groups, individuals with disabilities, and financial and legal planners. We also conducted an extensive literature review, and as I mentioned earlier, we conducted focus groups in Seattle, Washington that were held at the offices of the ARC of King County. Next slide. Recently in the New York Times, there was a very interesting article that I thought followed up very closely on the information that came out in our research and kind of looking at the 4 aspects of planning for the future. One was the team, the financial planners and the attorneys, the trust, if people were able to establish a special needs trust, a pool trust, or in some cases what people refer to as a Medicaid trust, an estate plan that also looked at financial resources, but also looked at a care plan or a future plan that looked at issues such as housing, support groups, where someone was going to live in the community, and then also benefits, both eligibility for benefits and for people who are already receiving benefits, making sure that they maintain those benefits, again, through not exceeding asset caps for Medicaid. Next slide. Another quote that I thought really came out of our focus group that I found people were very concerned about, and this was from an article in the Wall Street Journal earlier this year that said proper planning can be the difference between children becoming homeless or thriving once their parents are gone. And one of the issues too, as much as we talked about looking at the plan, day-to-day financial resources, housing was one of the main issues that people were concerned about. In many cases that housing plans had been made many, many years ago, and parents had thought that they would leave their home to their child, or that their child, when they became an adult and the parents were no longer able to care for them, would move in with another family member. We also heard from people that their parents were 70, 80, 90 years old and were still, had a adult child living with them who were in their 50s and 60s, and it was becoming very, very difficult. But the parents feared making decisions. Again, a lot of it was focused around the housing. Next slide. So when we began talking with people, we saw that planning for the future kind of went into 2 areas. One was the future or care and financial planning by the family. And this involved taking into consideration the interest and ability of the family member with disabilities or special needs, talking about guardianships, payees, will and estate planning, special needs and pool trust, care or future planning, housing, as I mentioned, support networks, and changing circumstances. And again, when we talk about changing circumstances, which came out very strongly in the focus group, as I mentioned earlier, as people were talking about, if their parents had done a will or a plan, that it had been done years ago, and it may have involved, the oldest daughter taking care of a sibling, or the first person to get married who had a home, that they would be responsible for the sibling, or the sibling wanting to stay in the home, but were not able to care for themselves and may not be in a community where they would have good access to in-home care. But again, looking at kind of continuing to reevaluate every year the planning that was made by the family. The other big issue, too, among people we talked to was also qualifying and maintaining government benefits. And this was also SSI, Medicaid, state-funded programs in which many cases people said that in order to qualify for certain programs, a person had to be receiving Medicaid assistance. And again, this was something that siblings were not aware of. And also eligibility for subsidized housing. In our discussions, too, we also heard from a number of people who parents were very committed to caring for a child, and even though as the child became an adult, may have been eligible for SSI or Medicaid benefits, the parents were continuing to pay for that on their own just because they had concerns about accepting government aid. They didn't understand what they needed to do to qualify, and they just felt that it was a family issue and they wanted to keep it within the family. Next slide. So as we went about talking to people and doing our literature review, we had 4 core research questions that we were looking at. How do families gather and analyze information about financial and future planning? And again, this was a follow-up to our 2010 focus groups, where we were finding that people had very little information. They were picking things out here and there. I heard this from somebody at school, or somebody mentioned this. So we really wanted to see, as siblings got older, if their family members were gathering or getting more information, and where they were getting that information from. We also wanted to see how families make decisions about future needs. How are siblings involved in these decisions? And also, how is that family member with the disability special needs involved in decision making? And following up on that, how well do siblings understand rules and regulations governing benefits? One of the things that we had heard from people was that, that's something my mother and father had always taken care of, and I guess I really didn't understand, where my brother's check comes from, or what comes from the federal government, what comes from the state government. So finding out how well people understood that. And then also looking at what are some of the obstacles to future and financial planning that siblings and their families were experiencing. Next slide. The general findings that were found was that siblings gathered information from a variety of sources, workshops, support groups, community-based organizations, the internet. People indicated that they spent a lot of time doing research. We also found that, again, people were very on top of the research, but as I'll talk about a little bit later, they didn't really know what to do with all the information that they were gathering. And again, this was a marked change from our earlier focus groups, where people just didn't feel they had the information, didn't know where to get information. The people that we talked to, and again, I do want to qualify that, in that the people that were in our focus groups and that we did spend a lot of time talking to are people that were involved with advocacy and support groups in their community. So, they may be substantially ahead of the curve of other people that have not reached out or have been able to access these resources. The next point is that financial and future planning decisions had primarily been made by the parents with limited input from other family members. We found this, a variety of ways that this played out. When we did the focus groups, we had people from 2 immigrant population groups, where they said, based on their culture, the parents made the decision. In one case, a daughter who was married with children, who had a stable home, the parents had made the decision that her adult brother with disabilities, would live with her and be part of her family. In another instance, when a family member turned 18, his parents had him sign up for guardianship training here in Washington State so he could be certified as a guardian, with the expectation that as the oldest child in the family that he would be expected to care for his brother when his parents were no longer able to do so. And then we had other people in the focus groups that said they knew their parents had done something, but they hadn't talked to them about it. They, in their family, they never talk about money, and they just didn't know how to broach the subject, or their parents had made a decision about that they wanted someone in the family to be the guardian or to manage their estate when they passed away, and that they were uncomfortable asking both the sibling and their parents to kind of reevaluate that decision. One of the things that we did find was that siblings did demonstrate a very good understanding about Social Security rules and regulations, and indicated that they were able to easily access information on the SSA's website, which is www.ssa.gov. They felt it was easy to navigate, that they could click on SSI, that they could click on trusts, other information, and they felt that it was very easily spelled out, and they really felt that they had a good understanding or knew where to get the information to go if they had questions. Unfortunately, that did not transcend to the state level. Siblings had much more difficulty understanding where to get information from state agencies that oversee Medicaid and other state funding support services. They were concerned about getting accurate information on asset limits for Medicaid and other services that were available. One of the things, too, that the siblings did point out that I think is very important, there are some wonderful support groups on the internet that exchange information. The people said it's very important to understand for Medicaid that different states have different regulations regarding asset rules, asset limits. States also have different programs and services available, and so they felt it was really important that when they were gathering information that they really wanted to look at where someone lived and if the regulations were the same in the state where they were living. Again, people felt that it was very difficult to navigate kind of the bureaucracies of state agencies, and that they didn't feel like things were simply spelled out like they were on the Social Security website. And again, this was just people talking about in the state where we did the focus group, so I don't want to make this as a blanket statement about all state agencies. We did look at a couple of other states, and there were a couple of examples where it was fairly easy to find things, but I think overall it was a little more difficult. And the general finding overall was the major frustration, the major concern that people had was engagement with their parents to talk about the future. And this came up, as I mentioned, in many different ways. People feeling that their parents were overwhelmed, people feeling that their parents were doing the best they could. They just found it difficult to say to their parents, can we sit down and talk about the future and also engage the person with disabilities or special needs if they're able to do so, to make them part of that conversation. Next slide. So we have three overarching themes that came out of the focus groups and our interviews and the literature review. And the first one is the information about financial and future planning. And as I previously mentioned, the people that we talked to felt that there were multiple sources where they could get information: government agencies, service providers, advocacy groups, websites, publication, parent and sibling support groups, training, workshop, professional organizations such as the Academy of Special Needs Planners and Special Needs Alliance. And they felt that that information was out there, and even before the phrase of binders became popular with the election, we did hear people saying that they had binders of information about, some of the resources available to them. For Medicaid, again, as I mentioned, it was important to look at individual state rules and regulations. And in some states, receiving Medicaid also made an individual eligible for other services, such as transportation, job training, recreational programs, in-home care, other types of services like that. But again, the question that people talked about, that one of our focus group members said, I have all the information, I'm just not sure how to use it. Next slide. And again, I think the issue that really came back to us was how to engage families in planning discussions. And the most challenging issues that we heard about are some of the following. A sibling was not receiving any eligibility benefits. So again, for example, Social Security, SSI, Medicaid, because the parents have been paying all the expenses. As the sibling got older, as the parents got older, more concern about financial resources, and some of the adult siblings that we talked to said, I don't even know how to go about applying for SSI or Medicaid. They knew that information was on the internet, but they weren't sure, if their adult sibling had never received it before, is that going to be an issue? How do they go about applying? Again, concern about their parents' wishes that perhaps the child never did receive any type, did not want their child to receive any type of government benefits. One person that we spoke to indicated that it was the intention of her father that her sibling not receive any government assistance, but that all of the children in the family were expected to contribute a percentage of their salary to help support their brother or sister, even though it did create some financial hardships for them. Another issue was that parents do not have a will, have not made any financial decisions, or received inadequate financial or legal advice. Again, this was following up also too on our the findings that we had on our focus groups in 2010 that were done in Iowa and Wisconsin. And one of the issues had been, particularly in smaller towns, that people had said, well, I'll just go to, the attorney that we always use, who helped us buy our house. And they said they know about trusts. Again, that there are, very specific rules and regulations around special needs trust, pools trust. Also keeping a will that will take into consideration when people's circumstances may change, either the parents or the siblings. In one case we heard about, parents making a decision about a home that was in a town that none of the other siblings lived in anymore, and it was just not realistic that, the individual could continue living there without any support, but the parents were unwilling to talk about that. And again, they had been given information that that was the only option that they had for future housing for their child. A big issue had also been that parents had not shared their intentions with family members, that when people asked their parents, what are we going to do, what are we thinking about, that they said it's all taken care of, it's all in our will, don't worry about it. But again, we found that siblings did have a lot of concern, and they did want to engage their parents in this discussion. The other thing that we saw too was that decisions were made without involving family members with disabilities or special needs. And particularly people who should have been able to be part of the decision-making process and consulted on where they wanted to live, how they wanted to maintain their community networks, if they were involved in day programs or if they had any type of employment. Again, that they could continue to do so, but again, concerned that decisions were made without consulting them or not having them part of the planning process. Another concern was that decisions were made without consulting the siblings impacted. And this again involved guardianship, trustee relationships, living arrangements, and this was the parents making decisions that, again, the oldest daughter will take care of, her brother or sisters or other children in the family, or that, a brother who is stronger, may be there to help his brother or sister, or, the first person to get married or own a home, or the one sibling who stayed in the community where their brother or sister parents grew up, that they would then be responsible solely in that, they weren't looking at other arrangements. And the final issue was that decisions were made many years ago and have not been revisited when siblings became adults or when parents' own health or care needs changed. And again, this was looking at people saying, when my parents said they set up, an insurance policy, and that money will then go into a trust, or that money will then go to me and I will be responsible for taking care of them, or my parents, have set aside all of their savings, and when they pass along, they want me to take care of my brother and sister, but then the parents' needs have increased and they need to take care of, they have their own financial burden that they're looking at. Another issue that we heard about too was in an instance of someone having a genetic disease, so that a sibling who had been born with a genetic disease had been placed, or the parents' intention were that that child would be in the care of a sister, and one of her own children also had the same disease, so it would be very difficult for her to care for that person and to care for her sibling and also for her child at the same time. Also too, that again, when people were getting transferred out of state, as siblings were moving out of the community, and again, the message that we heard is that they really wanted to, once a plan was done, to involve the entire family in going back and looking at that care plan on a yearly or, at least every couple of years basis, to still make sure that the decisions were good ones. Next slide. And again, kind of following up on this, the support that people needed, or in some cases they were already taken advantage of. Again, we heard a lot of very positive comments about groups such as the ARC, parent advocacy groups, sibling advocacy groups, are all helpful to start the planning efforts. A suggestion we heard from a couple people, too, is that they would be interested in having a facilitator come in and meet with their family, a facilitator who was not selling a product or a service, to bring families together. By this they meant not necessarily a lawyer or a financial planner, but someone, say, from a nonprofit organization or someone, that they could hire in the community that could come in and bring the family together to say, let's start, looking at the planning process in, again, a very neutral environment, so that everybody felt free to talk, and they also wanted to talk about, what their future plans were. Again, as I mentioned earlier, one of the people that was in one of our focus groups was an 18-year-old young man whose parents had told him when he turned 18 that he was going to need to take more responsibility for his sibling. And, we asked him, well, what are your future plans? What is it that you want to do? And he said, well, I always thought that I would like to go to college, maybe get married, but I don't know. I don't know if that option is even open to me anymore. So again, looking at all of that in the context of how decisions are made. And again, the support that people wanted was to encourage parents to be motivated and start planning early. And again, one of the things that we found was that people who belong to specific advocacy groups or in certain school districts, that their parents were getting the message to start, beginning their financial and future planning, talk to their siblings, talk to their other children, setting money aside, start talking about housing issues, maintaining support, and again, and involving the person with disabilities in these discussions. Next slide. And one of the things, too, again, in Seattle, where we have a very diverse cultural community out here, is that cultural traditions may lead families to take differing approaches to financial and future planning. And one of the comments that we heard was that people of certain cultural ethnic groups were uncomfortable participating in groups that may have involved, people from across different racial, cultural backgrounds, because they felt that there were some traditions that they wanted to be maintained, and they did not want to be judged accordingly based on these decisions. And again, this may involve, how the role of the family, the role of finances, where someone is going to live, how decisions are made. And one of the things that we were very impressed with when we met with the ARC of King County was that their family support program actually facilitates multicultural support groups for East African families, Southeast Asian families, Hispanic families. They also had a fathers group. So again, bringing people together who could talk about, financial and future planning in the context of their cultural traditions, which were very important to them. Next slide. So again, we had two kind of implications coming out of this. One was the ability and needs and interest of the siblings with disability and special needs must be taken into consideration. A person-centered planning approach that focused on the person rather than the systems that impact his or her life, so that decisions aren't made solely based on, we want to make sure this person maintains their benefits or, gets to live here. But again, looking at what is best for the person, and that as long as they're able to do so, that they have a role in this planning process. And the other point, too, was that a desire for the entire family to be involved in planning, and also the ongoing implementation of the care and estate plans. Again, that starting at the very beginning, and also as time progresses, updating plans if needed, taking into consideration what is happening to different family members in their lives, and again, making sure that the needs of their sibling are addressed as well as possible. Next slide. So again, thank you very much, and I will pass it on now to Karen Harris. Thank you.
For our discussants, as we go along, please feel free to submit those. Karen?
Hi, thank you very much. My name is Karen Harris, and I'm the director of the Asset Opportunities Unit at the Shriver Center on Poverty Law in Chicago. Next slide, please. The Sargent Shriver National Center on Poverty Law is a national law and policy center that provides national leadership in identifying, developing, and supporting innovative and collaborative approaches to social and economic justice for low-income people. The Shriver Center's Asset Opportunity Unit takes action against poverty by looking and advocating for policies that expand asset-building opportunities for all people. Next slide, please. In September of 2012, the Census Bureau released the 2011 poverty data, even though my slide is incorrect when it says 2010. The data I'm talking about is actually 2011 poverty data, which showed that there were 46.2 million people in poverty in 2011, which is up from 43.6 million in 2010. And the nation's official poverty rate was 15.1%. That's up from 14.3% the previous year. So in other words, there were 2.6 million more Americans in poverty than there were last year. This is the largest number of people in poverty during the 52 years in which data has been collected. These figures actually underestimate the number of people in poverty because the current federal poverty measure is outdated and flawed. Basically, it was developed in the 1960s based on the price of food, which at the time was about 1/3 of a family's budget. Today, however, food is only 1/7 of a family's budget. And while the cost of housing and child care and taxes and health care costs, none of those are taken into account in the poverty measure. So right now we're really underestimating poverty. So as a result, the Census Bureau introduced something called the Supplemental Poverty Measure. Next slide, please. And what this measure was meant to do was to update the federal poverty measure and make it more current and meaningful. And basically what it does is it takes into account not only the expenses that previously weren't considered, such as the health care cost or the child care or commuting costs to work that I talked about, but it also takes into account income support programs, so things like food stamps or TANF benefits or Medicaid benefits. So under the supplemental poverty measure, we have 49.1 million people in poverty, and that's about 16% of the population. But just like the official poverty measure, this updated poverty measure still focuses solely on income poverty. Next slide, please. In terms of people with disabilities, I just noticed that this has data from 2010 instead of 2011, but basically what we have is that in terms of the disabled population, households with a disability made on average 25,420 in 2011 compared to households without a disability that made 59,411 last year. According to the Census Bureau's data, 28.8%, or about 4.3 million people, people with disabilities were in income poverty last year, which is up from about 27.9% in 2011. Next slide, please. But focusing solely on income poverty really limits our view of poverty. Income poverty, unfortunately, only reflects whether or not people's income is sufficient to be able to get by. Asset poverty, on the other hand, focuses on whether or not people can get ahead. Unfortunately, most of today's anti-poverty measures focus solely on income poverty. Asset poverty, a family is considered asset poor if they do not have enough resources to survive for 3 months if all of their external sources of income disappeared. Focusing on asset poverty gives us a much different perspective on poverty. I can't tell if we're on the right slide, but it should be the one that says income poverty versus asset poverty, so I think it's the next one. In the U.S., while 1 in 6 families are income poor, 1 in 5 families are asset poor. And other asset poverty data reveals that we have a large number of Americans who are really financially unstable, and this number has grown significantly because of the current economic crisis. In fact, 1/3 of all U.S. families have 0 or negative assets. In terms of people with disabilities, it's estimated that as many as 80% of households with a disability have 0 assets. Next slide, please. There's a quote by a 1998 Nobel Prize economics professor who says that the relevance of disability in the understanding of deprivation in the world is often underestimated. And I think that's true because there really hasn't been a lot of focus on asset poverty and the disability community. Next slide, please. In particular, little attention has been given to the barriers that people face when trying to build assets. So, for example, and these are just a couple of that I jotted down, the general lack of banking experience or knowledge of the financial industry. That's true with the general population as well as people with disabilities. The lack of access to banking locations and or banking facilities. What we will see is that in a lot of neighborhoods there are not as many bank branches or credit unions as there are payday lending stores or check cashers. And then there's also policy barriers, and that's what I wanted to spend some time talking about. Next slide, please. In terms of public policy barriers, perhaps one of the biggest barriers are asset limit rules and public benefit programs. As this slide shows, most of the public benefit programs have some kind of asset limit. These asset limits limit the amount of assets that an individual or a family can own and still be eligible for the public benefit program. And as you can see, for most of these programs, the limits are only about $2,000 to $3,000, which in today's world really doesn't allow an individual to build the kind of assets that are necessary in order to not only get off of that public assistance program, but to become self-sufficient and financially secure and become economically mobile. Next slide, please. Luckily, states have the authority to eliminate asset tests or increase the amount allowed in such assets tests in TANF and Medicaid and with USDA approval in SNAP. And several states have actually gone ahead and started reforming their asset limits. This can be done either by legislation or administrative rule, depending upon the state. And these asset limits have, in some states, shown some changes. Next slide, please. So this chart shows asset limit reforms in some of the states and what can be done. So, for example, at least 6 states have eliminated asset limits entirely in their TANF programs. 24 states have eliminated them in their Medicaid program, and 36 states have eliminated them in their SNAP programs. Another option is to raise the thresholds to something more reasonable. So, for example, Delaware's TANF program's asset limit is $10,000, and Hawaii and Idaho's are $5,000. Minnesota raised its asset limits in its Medicaid program to $10,000, and South Dakota raised its to $30,000. Idaho's SNAP asset limit is now $5,000, as is Michigan's, and Nebraska excludes up to $25,000 in liquid assets and all illiquid assets. So one of the things that you could do is work with your state legislators to enact similar asset limit reforms in your state. One of the things that I have seen as a recent result of the financial crisis is that a few states have actually tried to reinstate asset limits that they had previously removed. The two good examples are Pennsylvania and Michigan reinstated asset limits. In Michigan, it seems like the reason that they did it was that two lottery winners won the lottery but remained on public benefit program, and there was a big public outcry about that, and then you saw a lot of states start instituting or at least proposing new legislation as a result of all the media activity over that particular case. But when it comes down to the statistics, the likelihood of something like that happen is very insignificant, despite the state's kind of rapid attempts to institute new legislation. Next slide, please. There's also been legislation proposed, although not enacted, on the federal level to reform asset limits. The couple of bills that I wanted to talk about specifically here that are relevant for people with disabilities are the Freedom to Save Act, which would have, for example, eliminated asset limits in SSI, SHIP, and NF, as well as raised the asset limits in SNAP to $6,000 and exempted all vehicles for each of these programs. The other important bill was very recent, which was the SSI Savers Act. It would have increased limits on assets or countable resources to $5,000 for individuals and $7,500 for couples, as well as index these to inflation. So, these are examples of some of the legislative proposals that have been proposed on the federal level that, if you're interested in helping people with disabilities to build assets, you should be concerned about and also speak with your legislators about. Next slide, please. Another particularly important legislative proposal is what's called the Achieving a Better Life Experience Act, or for short, the ABLE Act. It's been introduced in several Congresses, and it's in Congress currently. And what it would do is it would create so-called ABLE accounts that could be used to support all kinds of quality of life measures, including more independence for people with disabilities. Under the proposed legislation, an account would be allowed for every SSI beneficiary up to a maximum of $500,000. The legislation is actually written to define SSI beneficiary as anyone that is potentially eligible for SSI or SSDI, but is not getting it because of existing asset or income restrictions. What you could do is actually, under this legislation, is have this account of up to $500,000 and still be eligible for SSI. And from that account, you could pay for various expenses. So you could pay, for example, for education, employment support, personal assistance, respite care, assistive technologies, which can be very important for people with disabilities, such as home modifications or vehicle modifications. You could use it to pay for out-of-pocket medical expenses as well. Next slide, please. One of the ways that you can understand kind of what an ABLE account would be is to compare it to a special needs trust. So for those of you who aren't familiar with them, a special needs trust is a trust fund that is set up by an attorney for someone with a disability so that the person will remain eligible for public benefits but can also have this account for supplementary needs. One of the main differences between an ABLE account and a special needs trust is that with a special needs trust, the beneficiary is not the trustee and actually has no control over the funds. Additionally, beneficiaries are not allowed to contribute their own funds to special needs trust. So the special needs trust, while an important tool, do provide some limitations. ABLE accounts, on the other hand, would be more empowering and assist people with disabilities to become independent. So unlike a special needs trust, contributions to an ABLE account could be made by anyone, including the beneficiary. Contributions to an ABLE account would be tax deductible up to $2,000, and such contributions would not be considered earned income for purposes of SSI. In fact, an individual could even contribute his or her SSI or SSDI income to an ABLE account. And also, unlike special needs trusts, the funds in an ABLE account could be used for many purposes, including housing. So as people concerned about asset building in the disability community, one of the things, again, that you can do is to contact your legislators and ask them to help support this legislation. We were talking shortly before the webinar started, and Johnette Hartnett, who will speak after me, was mentioning that right now it looks like the ABLE Act has a lot of support in Congress. I think the numbers we were talking about were about 240 representatives in the House are supporting it, and around 30 or 30 plus in the Senate. So that's a piece of legislation that you can definitely contact your legislators about and ask them to support as well. Next slide, please. Legislative change is, however, a slow process, so in the meantime, there are other activities that you might want to consider. So, for example, our organization has given presentations to what's called the Disability Rights Consortium in Illinois. It's the umbrella organization for all the disability rights groups. We've also given presentations and trainings to the City of Chicago's Mayor's Office on People with Disabilities. And what we've been talking with them about is how you can use asset building tools in your advocacy with the disabled population. We've also partnered with financial planning, with the Trade Association for Financial Planners here in Illinois, and offered financial planning sessions for people with disabilities. So specifically, the Trade Association for the Financial Planners provided pro bono individuals from their membership who would come to a disability rights organization and offer one-on-one counseling for, say, a Wednesday evening or a Saturday afternoon. So those are the kinds of things that you might want to consider as you go forward with your work. The next slide, please. And I just wanted to provide a couple of resources. The Shriver Center has also done a couple of webinars on asset building in the disability community, which you can find on our website. The copy of the presentation we gave to the Disability Rights Consortium is also located there, as well as a law review article we've written about the issues and some of the possible solutions in this arena. And then also there's an SSI Savers Act coalition which you can join in supporting some of the federal legislation. And I believe Johnette, as she speaks next, may also talk about her organization's efforts to support federal legislation such as the ABLE Act. Thanks very much.
Wonderful. Thank you, Karen. And we'll turn things over to Johnette.
All right. Nicole, how long do you want me to go? Because there isn't a whole lot of time left. Would you prefer to do Q&A now, or?
No, I would go ahead with your presentation and just go ahead.
And okay, fine. Good afternoon, everybody. And this has just been just a great webinar to listen to the research that Kathy just presented on siblings. I come from a family. I had parents with disabilities. My dad had cerebral palsy. My mother was a polio survivor. And it's very interesting. This is rather new research about siblings, and it's always interesting when you hear the data, and a lot of the work that we've done does complement a lot of the findings that Kathy had. And Karen, it's always great to hear the Center on Law and Poverty and the great work that you're doing, and the real barriers that have been there for many, many decades that continue to really, not help people with disabilities move forward. If we could move to the National Disability slide a couple forward, just so we can move this along. The National Disability Institute was founded in 2002 as a program at the National Cooperative Bank Development Corporation in those days, and we developed a nonprofit status in 2006. And our main objectives have been to really increase economic and employment opportunities for people with disabilities. And, we started this because we were, myself and Michael Morris, who is the founder of the National Disability Institute, I spent a year on the Hill as a Kennedy Fellow working on welfare reform. Michael was there in the 80s, and really understanding that so many of the issues today around self-sufficiency and financial empowerment that were bubbling up toward the end of the 1990s, particularly around welfare reform, the Assets for Independence Act, we're all looking at people with low to moderate income, and we started raising our hand and saying, where are people with disabilities? And, as we know, the Americans with Disability Act in one of the clauses talks about economic self-sufficiency for individuals with disabilities. So all of the work that you're hearing about today is really, it's relatively new. I would say the work is just, we've been at this almost 10 years, and it's really new. And we're looking to expand, the next slide, please, expand access to the economic mainstream for taxpayers, and for more, moderate to low-income people with disabilities. And we did that through starting of the Real Economic Impact Tour back in 2004. Next slide, please. And we did that, when we started, we joined some of the existing nonprofits that were doing free tax work around the country, and at that time, about 6% of taxpayers with disabilities were accessing the free services. Today, just at the end of 2012 tax season, about 14% were accessing the free tax services. Next slide, please. But there's a new reality for people with disabilities, and we know this is about 54 million Americans that are self-reporting in the U.S. Census. We know that 18 million children are part of this data. We know from research that 2 to 5 times people with disabilities are more likely to experience poverty. You heard that from Karen. 28%, or nearly 1 in 3, live in poverty, nearly double the national poverty rate. We pay out-of-pocket health expenditures. The average is $795 versus $256 for people without disabilities. One of the recent studies IRS did found that 18 million taxpayers said they would access the free tax services that were offered in the country if they knew about them. So not only do people not know about financial services, they don't even know about the free tax services in the community. So we are really growing poverty and not prosperity in this country. And I'm going to skip over some of this data, but it really looks at, right now, in any given month, there's about 50 million people in Medicaid. We know that there's been about 58%, according to the Harris poll, 58% of people struggling to get by, going into debt each month, living paycheck to paycheck, were people with disabilities, compared to 34% without disabilities. We know about 46 million on any one month right now are on food stamps. And what was most disturbing was the study that came out 2011, Feed America, that said 40% of people accessing food pantries, shelters, and kitchens reported being on SSI. So looking at the profile and gaps of taxpayers with disabilities, 58%, or this is the adjusted gross income from IRS, earn less than $20,000 compared to 35% without disabilities. We know about 22% earn over $40,000 compared to 42% without disabilities. I'm not going to go through all that data, but one of the slides that, one of the data points under the finances, and I know the slides are moving a little faster than I am, 30% of taxpayers with disabilities that were accessing the free tax prep said that they used a checking account compared to 66%. And we did a study, focus group study with the Ford grant in 2006 with IRS. We actually went to 4 cities and used a OMB approved instrument. We actually had 6,000 people surveyed, and it was pretty stunning. Most of our participants coming were using the free tax work, reported they could not tell us what the eligibility was for the public benefits they were on. They did not really understand. And many really had difficulty with understanding the nuances of public benefits and ownership of assets. That report is Educating Democracy. It's at the end of our report, but that's an older report. I have a newer one that I'm going to talk about here. I'm going to skip the profile on disability. Actually, thank you. I'll stay right there. I think that it's very important to know that the 52% of people right now are over 65 have a disability, and that rate goes way up when we reach 75. 6% are using wheelchairs, 6.5% sensory disabilities, and about 11% are enrolled in higher education. I think what's so important about this, and you can get your state's profile on CornellDisabilityStatistics.org. So important about this is when you start looking at the financial pieces, because they're so wrapped up in people's income, their mobility, their functioning, and where they are rural in the geographic piece. So when we look at the demographics, I'm going to have you move to the next slide, but the demographics really tell the story on where disability is located, and the numbers working when we look at the ethnic piece. And then when we look at, I threw in the voting numbers because this was, I was at a niche conference in May and was very taken when the government affairs person talked about the low numbers of voting. They had a quote, 35% of disability was not voting. So the importance of disability getting out there when we represent such a large proportion. Next slide, please. The financial wellness survey that the National Disability Institute and Elizabeth Jennings, who is on board with us here, was really the architect of this work, was actually an online financial survey of 3,011 people with multiple sclerosis. And I'm not going to go through all of the findings, but again, the report is, I think I sent an attached report, a PDF, but you can also go at the end of the slide, the presentation, you have the information for that study. And what's interesting about this report compared to the report we did in 2006 in the 4 cities, and it was a different demographic, okay? So we found that the MS population was pretty well educated. 94% had checking accounts. 4 in 10 had no savings account or money markets or CDs, and less than half had investments in a 401k, and 26% investments in stocks and bonds. So a little bit different demographic than the population that I've been used to working with, which is the low to moderate. But about 26% were aware or had used like the earned income tax credit, which is a real asset building opportunity. Even for somebody making $5,000 a year, you can apply for the credit if you do file a return and maybe get $100 or $125 back, and that's retroactive 3 years. And then if your community has a match savings program, a federal match savings program, that would match it either $1. We had some cities where they were matching $4 a few years ago. That can start to create some assets, and up until, I guess, the end of this year so far, that money that's accrued in the federal IDA program is exempt during the life of that program as an income or resource. So it's very, very powerful. And less than 1% were aware. This is the MS survey that was done. Less than 1% were aware or used an IDA program. Less than 0.5% knew the family self-sufficiency program, and 1.2% knew about the plan for achieving self-support. These are all programs that help families increase assets. And 73.7% were not aware or had used any of these programs. And again, when we get to the trusted contacts for financial advice, and Kathy's presentation reminded me back in the early 2000s when MetLife had I don't know if they still have it, called MetDesk. And they did a survey, and it was one of the first surveys I ever saw about families and financial, families with disabilities and financial access. And the study found that they asked families, where do you go to get financial information on financial planning? And over 60% of the families said they went to their family doctor. And that's always stayed with me. And when I looked at this survey that we did this year, this survey found that 4.3% is a doctor. 1.8 used a clergy person. So I'm going to move on to the next slide, but that study in itself deserves a webinar. It's pretty fascinating information. I think another area that we've been very involved in that is looking at the use of technology. And because we know, especially in the financial world, right now the use of technology is just booming. Africa and Asia is like the major user, mobile banking and technology. Africa's number 2. We haven't quite caught up in this country, but 2% of people have disability or an illness that makes it harder or impossible to use the internet. Only 2%. And 39% of Americans without broadband access are living with a disability. So we have work to do in that area. We know there's a couple of states that don't even have, that still have dial-up. I think Montana still has dial-up. So we do need this across the country. And I think as you look at this, 10% use tax prep software compared to 20%. We're very involved this year coming up, and we have been for 4 years with United Way Worldwide, and this year with Goodwill International and funding from Walmart, going into a 5th year to really promote online do-it-yourself tax prep. And IRS, I attached their study because I think it was really important. There have been 2 very excellent studies on the profile and characteristics of taxpayers with disabilities that IRS Wage and Investment Research did, 2007, 2010. They are, again, listed at the end of this, and that data is there. But one of the findings always stood out to me was in the 2010 study, the IRS recommended other agencies partner with tax prep software companies to ensure that software is disability compatible and accessible. And next slide, please. We know that that is a major, major issue. I'm at 3 o'clock. Nicole, should I stop?
It's to make some final points.
Okay.
It's okay. We can go over.
Okay. Thank you. I think that on to the next slide. I think the self-sufficiency investment model. I think this is at the end of the day, when those of us that have been in disability all our lives and are looking at, where is this going? We have lived in the past, let's say 60 to 70 years, have been a cyclical dependency model. I'm not going to walk through that, but historically, it was, I think our book rehab was 1922 and civil rights in the 60s. If you had kids in the 1970s, they were just barely able to go into a general classroom in the mid-70s. So we've made great progress. We have a great way to go. And one of the things I list there, the asset limits, for financial planning, everything is still very, very based on 50s and 60s legislation. And there's, it's created chronic impoverishment, cyclical dependency, and really loss of human dignity across the lifespan. We're really looking, and especially those that are in many of the younger parents I see today, and there's a collaboration for people with self-determination here in Washington. Many of the young parents of kids with lifelong disabilities want their kids to be full citizens, and they want them to work, be independent, and have access to everything we're talking about. And that's a self-sufficiency model for the 21st century. Next slide, please. I think this slide is the one that gives me a great gulp as a researcher and a policy person and a family participant who grew up with disability. That right now we know with the deficit cuts, this is a study that Mathematica gave out. I think it was last September. The total spending on disability was almost $500 billion, $429 billion. And that was a 30% growth. And I think what is most disturbing when you look at it is that almost half of it was income maintenance, more than half is health care, less than 3% for housing and food assistance, and only 1.2% for education, training, and employment. And we know why our employment rates and why we continue to struggle. So next slide, really building a roadmap out of poverty is what we're talking about. And unfortunately, we have even in the financial world, we know there's many families that have disability that can afford to have special needs trust. Then there are families that cannot. I am president of a pooled special needs trust, and that began 7 years ago here in Washington. It has has a charter in Washington, Virginia, and Maryland. It's called SharedHorizons.org. And we've grown that trust from $300,000 to this month $11 million. We have 400 beneficiaries, and these beneficiaries are many are working, but these are many people that have representative payees that might have inherited a small amount. Their average trust is about $45,000. So the financial story is very different across disability, just like it is in the non-disability world. It depends upon, has a lot to do with the characteristics of profile and demographic and geography, as Kathy pointed out in some of the research that she has done. The next slide, please. And I think that one of the areas, again, that has been very important in the financial and tax work that we've been doing at the National Disability Institute, and we have really done a lot of work with the death tax, looking at helping death taxpayers get access to, really good, solid tax preparation. And we found that deaf on deaf, which isn't really surprising, but it is for people that don't know. Deaf ASL, American Sign Language, is not English, and that we found that people that had the deaf on deaf returns were better quality, and we actually used video relay services to do those returns. Virtual Vita this past year, my colleague Michael Rausch piloted in Florida and several sites. We used typical, software like Skype, and people were allowed to scan in their information to a local site, which happened to be the United Way of Tampa, and was very successful. The major drawback wasn't the actual process. It was having, materials and software that was old. This year, again, we're going to be working with the Southeast ADA Center, previously known as the Disability Business Technical Assistance Centers. It's called Tax Access. It's a website for all of our communities to access and call in to receive real-time information on access issues. Our social media communications work, we actually have produced a series of radio reading service ads specific to economic empowerment, tax filing, and we took those 30-second, 60-second ads, and they were broadcast, I think, last year in 9 states, and we repurposed them and added pictures, put them on YouTube, gave them captioning, and we were just really excited about that. We're expanding those this year as well. And all of this information is available, and this is available to all the communities. These are not proprietary. We also did a lot of work with Twitter, and I have to tell you, the future is going to be online technology and social media. And our work that we've been doing with Walmart, called My Free Taxes, this year United Way Worldwide again, and Goodwill International and NDI, we actually, last year, increased the number of online users 107% by using a very, very strategic social media campaign with approved tweets that were on a central management information system. And I can't go into that because, again, just the social media piece is another whole webinar. We found that many of our partners around the country have a Facebook page or they have a tweet or whatever, but they're talking to each other. And there was really ways to help them fix their, even the URLs were going to, not directly to them, they were going to a general Facebook. So there was tremendous findings, and we're going to hopefully this year improve it. We're going to do another series of webinars this year that will continue as we're doing here today to help people understand the needs. Our first one will be December 13th at 2 p.m., and it will highlight the My Free Taxes playbook for 2013. We have a number of virtual toolkits and online learning. We haven't opened our online learning, but we have a whole online e-learning portal this year that's going to give every tax site in the country a volunteer training for working with customers with disabilities. So there's a lot of I think, next slide, please. As NDI, I'm going to skip that page, and I'm going to skip the path to prosperity if you can just move forward. I think a lot of people are asking, like, what is the new next big thing? And I have been working up in the state of Delaware, working on with their Stand By Me project. If you could move to that, I know it's hard, to that slide. It's a picture. They have a coaching model called Stand By Me, and Governor Markell is now the chairman of the National Governors Association, and his platform is employment and disability. But prior to that, he was a state treasurer for almost a decade and was very interested in financial empowerment, and has supported the growth of a coaching model that was adopted from New Mexico's coaching model. And really, when I heard Kathy say that the parents, wanted someone to facilitate, to talk to, the coaching model that they're doing in Delaware is a statewide model, and it's bringing together diverse partners. And as you can see from the slide, it's pretty powerful. It's bringing together all the players that we all work with in every one of our cities, but on a state level. And everybody has different missions, but under this project, they all are sharing the same mission. And that's to build really a better economic future for people in Delaware. And disability, of course, is part of that, but it's not all of it. And what we've been doing is working closely with the disability organizations on the ground to make sure that the coach, which is not, by the way, an advisor, the coaches simply help people, direct people to the resources, that we've been combining some of the coaches with, for example, different coaches from like the AARP program that's doing the money management program, or the ADRC, the Aging and Disability Resource Centers coaches, to help people that are leaving institutions and going back into community living. We've been combining meetings so that a money coach is sitting at the table with a specialty benefits coach, because I think at the end of the day it's tough to know all of that. So as we move forward, the next slide, what are the financial capability strategies that I think all of us are going to have to get really good at as we move into this next year, which is going to be a critical year, particularly I think for the populations that we are all serving, and of course particularly for disability. We really have to have the public policy. We have to mobilize our on-the-ground partners to really become involved. As you heard Karen talk about the ABLE Act, it has it's been around a long time. The structure has been adapted to a 529 model to make it more appealing, and all sorts of things have been done. The CSPD, and I will send out information on that to Nicole so people can contact them directly for support. We need to have more synergies across diverse organizations, public and private. Disability needs to not just talk with disability, but we need a lot of non-disability partners, as we have found with the Real Economic Impact Tour, working in over 100 cities across the country, that our non-disability partners have taken on the work. And the workforce system this year will be our new partner for our tax work. We're going to be working in 10 regions around the country to promote the online filing. I think the coaching and financial education programs, the budget, the credit counseling, the savings and planning, people are looking for that. We really need to teach people how to file their own, how to get access. Again, families need education across about benefits and financial education. We have many partners. I mean, as you heard, the ARC, UCP, the parent-to-parent group in Minnesota, many of them have financial components, Easter seals. There's Pool Trust, with the World Institute of Disability. I mean, there's many organizations that are doing variations. Protected Tomorrows is a fabulous organization outside of Chicago that specializes in family and financial planning. But there is no one place for people to go. So it's a very siloed, and people are confused, and as we heard with the early research, they really need help. So I'm going to stop there. It's been really an honor to be on the call. Thank you for letting me run over 13 minutes. But it's like, I think this is just, it deserves, many hours of conversation. And it was an honor to be, a discussant on this webinar. Thank you.
Thank you, Johnette. And I'd like to extend thanks to Kathy, Karen, and Johnette for sharing very important and timely information. We'll be archiving this webinar and the PowerPoint slides at cfs.wis.edu within the next couple of weeks. And I'd like to also draw your attention to the homepage of cfs.wis.edu. We have a practitioner brief that covers the information from Kathy's focus group research, and it's on the front page under the bucket on the bottom right-hand corner, recent publications. The next webinar will be taking place on Tuesday, December 11th, and that will be about household debt. And just one other housekeeping item, the center is going to be sending out a survey to people who have participated in webinars over the last couple of years. It's an optional survey, but we'd appreciate you taking the time to provide your feedback on the webinars so we can make them better and meaningful and just gather the information. And so look for that link in email, and we're going to be hosting a random drawing for people who participate in the survey to win an iPod. So thanks again, everyone, and have a great day.